Bacampicillin is an ampicillin prodrug used to treat various susceptible bacterial infections in the body, such as respiratory infections and skin and subcutaneous tissue infections. In this video, let's find found. What is bacampicillin? What is bacampicillin used for? Contraindication. What are the side effects of taking bacampicillin? How does bacampicillin work? How to use bacampicillin? What is bacampicillin? Bacampicillin is a penicillin antibiotic. It is a prodrug of ampicillin with improved oral bioavailability. It was sold under the brand name Spectrobid and in 2015. Pfizer discontinued Spectrobid, and no generic manufacturer has taken over production. Bacampicillin is thus unavailable in the United States, and is no longer FDA approved. What is bacampicillin used for? For infections at the following sites: upper and lower respiratory tract, skin and soft tissue, urinary tract, and acute uncomplicated gonococcal urethritis, when due to sensitive strains of the following organisms: gram-positive, streptococci, including S. faecalis and S. pneumoniae, and non-penicillinase-producing staphylococci, gram-negative, H. influenza, and gonorrhoeae, E. coli, P. mirabilis, salmonella, and shigella. Contraindication. Contraindicated in patients with infectious mononucleosis, blood cancer, HIV infection, and hypersensitivity. Side effects. Bacampicillin use is associated with gastrointestinal disturbances, rash, and hypersensitivity reactions. Gastrointestinal effects include nausea, vomiting, anorexia, diarrhea, and gastritis. Pharmacodynamic. Bacampicillin is a prodrug of ampicillin and is microbiologically inactive. Mechanism of action. During absorption from the gastrointestinal tract, bacampicillin is hydrolyzed by esterases present in the intestinal wall. It is microbiologically active as ampicillin, and exerts a bactericidal action through the inhibition of the biosynthesis of cell wall mucopeptides. Half-life. Not available. Dose. Bacampicillin 1,600 mg twice daily appears to be an effective and safe treatment for most episodes of acute exacerbations of chronic bronchitis. Safety advice. Category B, no evidence of risk in humans, but studies inadequate. That's all the information about bacampicillin we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.